Peds growth and development. The use of visual aids such as picture books, puppets, and dolls should be used on which age group? Infants, toddlers, preschoolers, or school age? What do you guys think? And the correct answer is toddlers. So take a look. Visual aids, because they can't read yet. I'll say visual aids, picture books, they can't read yet. So they really love the picture books and the puppets and the dolls. Remember, the toddlers, which is around age 1 to 3, they still have that imaginative thinking. So they love these type of dolls because it helps with their imagination and you can get the story across. They can't read yet. So we're not going to give it to preschools where they're learning to read or the school age. And the infants, what are the infants going to do with a puppet or even a picture book? They're too young to even understand the significance. So the perfect age group is going to be the toddlers, which is around 1 to 3 years age. 1 to 3 years of age. If you guys still, if you guys see me looking across, I forgot to let you guys know, here on YouTube, you're watching my video. I also have a live going on TikTok. So I have lots of people watching and answering the question on the live stream on TikTok. So I'm keeping an eye on them and their answers while I'm also doing this YouTube video. Okay. Holding, rocking, cuddling, and patting are appropriate forms of nonverbal communication for the infant. True or false? Very good. True. We're talking about infants. So from birth to about 1 year old, right? So that's how they get that sense of security and that sense of protection and that sense of love from rocking and holding and cuddling. And something I didn't put in there, but I'm going to tell you, speaking gently and softly to them. Okay. Well, actually, if you spoke, that wouldn't be nonverbal. That would be verbal. That's why I didn't put that in there. Okay, look at that. Nonverbal communication. But something else that is a form of verbal communication that the infants absolutely love is when you speak to them in a very gentle and soft manner. But this question was asking about nonverbal communication. Holding, rocking, cuddling, patting, all of these are great for the infant. It's important to encourage independence, provide privacy, and use books, pamphlets, and videos for which age group? Preschooler, school age, adolescent, or infant? What do you guys think? Come on, I see you on TikTok. Put your answers in. Okay, very good. Most of you guys chose the correct answer, adolescent. Let me tell you something. The minute you saw privacy, you should have been thinking most likely adolescent, because with the adolescent, a couple things I'm going to tell you because NCLEX expects you to know this. The job of the adolescent is to figure out their self-identity. Who am I in this world? Where do I belong? And the way that they find out their self-identity is through their social groups. And this is what's so crazy, because as much as they want to be an individual, they want to be their independent, they want to be their own person, they want to be, different, they don't want to look different or act different or seem different than any of their other friends. So even though they want they want that sense of identity, they also don't want to be different. So that's one thing that's very important you need to know about the adolescent. The second thing you need to know about the adolescent is that they want to be treated like adults or very close to adults. They want a sense of independence where they're free to make most decisions in their life, right? So independence, privacy is very big for the I can't speak today. Guys, I can't speak. I'm sorry. It's very big for the adolescent. But let's keep going. The use of books. So the use of books and pamphlets, Even if you were on the shelf and you didn't know what answer you should have chosen. When you saw books and pamphlets, you should have said, you know what, not so much for the preschooler or even the school age, because the school age child, they're reading books, but there are other ways we can teach them. So you still should have said to yourself, most likely, I'm going to go with the adolescent, because for sure infants not going to be reading any books or pamphlets. Okay. Which milestone is not seen in the infant between 2 to 3 months of age? Turning their head side to side, following objects with their eyes, smiling, or drinking from a sippy cup. What do you guys say? Very good. Drinks from a sippy cup. All of the other choices you'll see between 2 to 3 months of age, they should have what's known as the social smile, where they're smiling not just as a reflex, but they're smiling to show genuine happiness or satisfaction or joy, right? Them following objects with their eyes. They don't have to move their head. They're just following the objects with the eyes. They can do that. They can see mom or daddy or whoever it is. They're following with their eyes, or even turning their head from side to side. You see that between 2 to 3 months of age. But the sippy cup, we don't expect to see that pediatric patient drinking from a sippy cup until what? 12 months, 1 year old. Remember that 1 year of age, that's a huge milestone. That's when you're telling the parents, no more formula. Patients got to go to gallon milk, and we want the whole milk, not the fat-free milk, because during that time of toddlerhood, there's a rapid growth, right? And they need that fat in the milk. So we teach them no more of that formula. The patient's going to bottle milk, and no more bottle milk. They're going to gallon milk, whole milk, right? And no more bottles. They're a big boy, big girl. They're going to what we know as sippy cups, and those are the transition to, regular normal cups. Very good, guys. At how many months is an infant expected to be able to grasp objects, roll over, and switch objects from hand to hand? 4 to 5 months, 6 to 7 months, 8 to 9 months, or 10 to 11 months? Very good. 4 to 5 months. And guys, I'm very strategic in picking these questions. These questions that I'm picking are the concepts that have been seen on NCLEX over and over and over again. You are expected to know this. So around 4 to 5 months, that's when you should see them, grasping and being able to roll over and make switch, if they have an object in one hand, to put it in the other. Okay. True or false? Around 6 to 7 months, the infant is expected to creep, sit with support, and be able to wave bye-bye. What do you think? Come on, my people on TikTok, put your answers in for me, please. Thank you. Very good. By 6 to 7 months, they should be able to creep, sit with support. When they sit with support, guys, even without support, sometimes they can do that, but just for like very short time, and then they topple over. But with support, when it says support, like you putting a pillow or something to support them sitting up, you should not expect to see them topple over. And you should expect them to be able to do the simple wave when they say bye-bye, and they can go like that. Which milestone is not expected to be seen between 8 to 9 months? Sitting unsupported, crawling, showing stranger anxiety, or standing while holding on to something? Which do you not expect to see between 8 to 9 months of age? Showing stranger anxiety. So here's the thing. Matter of fact, I gotta check on this one, because stranger anxiety, we see this around 7 months of age. Why is it not? I think this was supposed to say which milestones expected to see between 8 to 9 months of age, because between 8 to 9 months of age, they'll have strange anxiety. Oh, well, 7 is outside of 8 to 9 months. That makes sense. Okay. Yeah, that's true. We see they start to have that stranger anxiety around 7 months of age, where they're like, I really don't know you. And they either won't want to go to the person, or they will really fight it. They will, fight it, especially if it's a healthcare provider. Okay. I think I could have worded that better though. The newborn weight is expected to double at how many months? Is it 2 months, 4 months, 6 months, or 8 months? What do you guys say? The newborn weight. This is another biggie. If you are taking peds right now, you're going to see this on the test somewhere. Make sure you know it. Very good. Most of you guys chose the correct answer at 6 months. You know what question I'm about to ask next. I hope I ask it next. Yep. Newborn weight is expected to triple at how many months? 6, 8, 10, or 12? You guys are doing great on the live. I see you putting your answers in. Very good, 12 months. So at 6 months, we expect their weight to double from birth, but at 1 year old, at 12 months, we expect that birth weight to triple. Very good. You guys are doing awesome. Which is not a sign of readiness in toilet training? The ability to speak 2 sentences, ability to sit, squat, and walk, the ability to remove clothing, the ability to stay dry for 2 hours. What do you guys think? The ability to speak in 2-word sentences. That does not let you know if that child is ready to be toilet trained or not. It has nothing to do with them being able to be toilet trained. But everything else does. The ability to be able to sit on the toilet, to be able to squat, to be able to actually walk to the toilet, yeah, that shows readiness. Ability to actually take off their clothes because they know they have to go. They're going to have to be able to take off their clothes. And the ability to stay dry for 2 hours. What does that mean? What does that show you? That they have some kind of control over their sphincter, right? So those 3 things will show a sign of readiness, but not being able to speak 2-word sentences. Toddlers are at risk for aspiration of which types of food? Select all that apply. Okay, guys, you know how to treat select all that apply as true or false. Nuts, raisins, popcorn, grapes, hot dogs, apple slices. What do you say? Guys on the live, you could put in the color if you like. I want to see what you're thinking. Okay, let's talk about this. So we're talking about foods that are high risk for that pediatric patient choking. Here's the thing. You never want to give something to a pediatric patient that is hard to chew, that is hard to swallow, that is completely round and can occlude the airway, something that doesn't dissolve very easily, which means that the enzymes in their saliva and them chewing is still not enough, to break it down. So nuts, that is a high risk for that patient to aspirate. Raisins, high risk. Popcorn, high risk. Grapes, high risk. Hot dogs, high risk. Absolutely. So let me tell you something. You have to teach those parents, if you insist. So what you tell them, don't give a whole grape. What are you going to do? Cut that grape in half, or even half of a half. So if it does accidentally get occluded in their throat, air can still pass through. It's not completely occluding the airway. And the same thing for hot dogs, right? So the only one that's false here is the apple slices. Parallel play. This is often seen in which age group? Infants, toddlers, preschoolers, school age. If you are taking peds right now, I promise you're going to see this somewhere on a test. Make sure you know the types of play for children. So what do you think parallel? What age group? Toddlers. So they go from solitary play where they're just playing by themselves now that they're toddlers, parallel play where they're still playing by themselves with a toy, but next to another child that's playing by themselves with the toy. They're parallel each other. So each child, they're not playing together. They're playing individually with their own toy, but next to each other. That's what's known as parallel play. And that is what you expect to see in the toddler age group. Cooperative play is seen in which age group? Infant, toddler, preschool, or school age? Cooperative play. Keep the answers going on the live. Very good. Preschoolers. So here's the thing with cooperative play. So in infancy, we had solitary play where, the infant would just play with a rattle or whatever it was the infant was playing with. Then we went to toddler where they'd have the parallel play. Now we have the preschooler and they have what's known as cooperative play, which means they're finally playing with each other. Here's the thing though, guys. Even though they're finally playing with each other in cooperative play, it's very loose rules, if any. Usually there are no rules at all. They're just running around and happy to be playing with each other, but it's not really organized, okay? Cooperative play, preschooler. Very good. The use of pictures, books, dolls, videos. These are appropriate to explain procedures to which age group? NCLEX loves to ask this as well. What do you guys say? Toddlers, preschoolers, school age, or adolescent? What do you guys think? School age. Take a look. Pictures. They love pictures. And books because they can start to read now, right? Dolls, videos, all of those are great tools to use when you're explaining procedures to a school age child, because the school age child, they're old enough to understand that something's coming up and it's scary. Because let me tell you something about these school age children. They are very concerned with bodily integrity. Okay, they are very concerned about pain. So you have to alleviate that source of anxiety by explaining to them what they're going to go through. And you do so by pictures, books, dolls, or videos. And usually, just for test taking purposes, they won't give you all of these. One of the choice that you'll usually see is going to be the doll. And that's how you explain it. So you'll show them, hey, you'll get a blood pressure your blood pressure is going to be checked. And so it's something, and you point to the doll's arm and you say it's something that wraps around the arm and just gives the arm a hug. When you say gives the arm a hug, it makes that child understand that there's going to be a squeezing or pressure sensation. Okay. According to Erickson, in which psychosocial stage must the child gain a sense of control and willpower? Trust versus mistrust, infancy. Autonomy versus shame and doubt, early childhood. Initiative versus guilt, late childhood. Or industry versus inferiority, school age. Now, guys, I was nice. I gave you guys the age groups for testing purposes. You have to know which age group goes which stage, okay? So the correct answer is autonomy versus shame and doubt, and this is early childhood. So let me explain this to you. Again, if you're taking peds, I promise you're going to have to know that autonomy versus shame and doubt. You're going to have to know the age group that it goes with. I was just being nice. I gave it to you. But let's talk about this. So autonomy versus shame and doubt. This is the early childhood. What are the big milestones that you're thinking about for early childhood? Is it a potty training where you're learning to control your sphincter. Control your bladder. Isn't this the age where everything's no, even if they mean yes? Do you want some ice cream? No, they really want some ice cream. But this is the age where they're testing out control, right? So they want to do things for themselves. And so autonomy versus shame and doubt, they want to, like I said, they want to start doing things for themselves. And if they're not able to, you want to know what happens? They have a sense of inferiority. They have a sense, they feel like, okay, everyone else is great, but something is wrong with me. So at that age in early childhood where they really want to try things out, you need to allow them to try things out. But here's the thing, don't give them a project that they're guaranteed to fail at. Let them try something out that you know they're going to succeed at. So you could say, oh my gosh, Bobby or whoever, you did such a great job. I'm so proud of you. So they can have that feeling of, wow, I did this by myself. I didn't need any help versus them having that shame and doubt. Does that make sense to you guys? Guys, does that make sense to you on the live? Okay, good. True or false? During the adolescent stage, identity versus role confusion is the primary psychosocial crisis. True or false? True. True. Remember, I told you guys when it comes to the adolescent, it's all about them figuring who am I, figuring out their identity. Who am I and where do I fit into this world, right? And the way that they figure out who they are is through their social group. That is the big milestone that they have to achieve. And that's the psychosocial crisis that they have. Who's the theorist for psychosocial development? Freud, Erikson, Piaget, or Kohlberg? What do you guys say? Very good, Erikson. So when it comes to psychosocial, Erikson's all about that. Now let's look at our other choices. Freud was more about psychosexual. Piaget was more about cognition, you know, how you think. And Kohlberg was more concerned about moral development. True or false? The id operates on the pleasure principle and pays no attention to the consequences of its actions. True or false? True. So, guys, you have the id, the ego, and the super ego. And I don't want to say too much because I think my next two follow-up questions are about these two. So I don't want to say too much. But when it comes to the id is all about me. What makes me happy? Forget anyone else. We don't care about consequences. I just want to fulfill my desires and whatever makes me happy. That is the id. Which part of the personality operates on the reality principle? Its function is problem solving. The id, the ego, the super ego, or I have no clue, Professor D. I don't even know why I'm here. I give up. What do you guys say? You guys are funny on the live. Come on, you guys know this. Wow. Okay. So the ego, that is the reality principle. So just like the id was all about my desires, the ego is the reality principle. So the ego says to the id, okay, I know you want $1 million, so you think robbing the bank is a good idea, but let me bring you back to reality and let you know if you rob this bank, we're going to be up in jail. All right. So the ego really is your check for the id. True or false? The superego is the opposite of a conscience. It avoids values, standards, and moral convictions. True or false? What do you guys think? And based on everything we've talked about so far, you should be able to guess the answer, even if you're not 100% sure. Thank you for the gifts, guys. I see them coming on the live. Thank you. False. False. Guys, how did 13 people pick true? Look at what the statement says. It says that the superego, we haven't talked about the superego yet. The superego is the opposite of a conscience. It avoids value, standards, and moral convictions. If we already talked about the id, that's only about its desires and it doesn't care about consequences. And then we talked about the ego, which checks the ids and say, hey, let's come back to reality. And that's the ego. What do you think the super ego would be? The super ego would be even more of a conscience than the actual ego itself. The super ego is the one that's full of value, standards, moral convictions. The super ego is the one saying, you know what? I'm not going to do this, not because I'm going to go to jail, but because I know it's the wrong thing to do. And I just don't want to do the wrong thing. All right, guys, make sure you know the difference between the three, because if you're taking psych or you're in peds, you're going to see that again as well. So let's see how you guys did. Number 3, third place, Jem. Very good. Congratulations, Jem. Second place. Jazz. Congratulations, Jazz. First place. Future RN 23. That's right. You are future RN. Congratulations. Runners up. Fourth place, P. Second place, I think it said IPK. Congratulations. You guys all did a great job. Guys that are watching this YouTube video, thank you so much for watching this video. Please give this video a thumbs up if you haven't done so already. Don't forget to subscribe to my channel or tell a friend about it. And also, don't forget, if you go to my website, I now provide NCLEX NGN reviews. You'll get all the booking information, and you can also get audio lessons available on my website, nexusnursinginstitute.com. Thank you so much for watching, and you guys catch me on the next video.